So the Cancer Center has been under redevelopment for the past 4 years. So we've been opening up parts of the Cancer Center since the fall of 2010. And we're actually still opening up parts of the Cancer Center as we speak. And we suspect that every part of the redevelopment center would be open by the end of March of this year, 2012. So we have not yet actually had an official opening of the Cancer Center. We're planning that, and we're likely to have that sometime in the spring of this year. Cancer Center's been part of KGH for the last 40 plus years. So we actually, through the redevelopment, added on to the existing Cancer Center, added 2 floors. And we extensively renovated the existing Cancer Center that was built, I think, in the early 70s. We're one of 13 cancer centers in Ontario, and we see about 2,800 new cancer patients a year here. And that translates into about 300 patient visits a day. We have about 130 patients who come every day for radiation. We treat about 70 patients a day for chemotherapy here in the Cancer Center. And then the rest of the individuals who come here on a daily basis see the physicians and the nurses and the team in clinic. We're the only provider of radiation treatment in southeastern Ontario, so if you require that kind of cancer therapy, you come to the Cancer Center in Kingston, and we have a number of expensive machines that we use to deliver radiation treatments on a daily basis, to plan those treatments and deliver care. We also provide chemotherapy or systemic therapy, which is really the use of drugs to treat cancer, and we do that out of the Cancer Center here. There are some specialized treatments that we provide here. We are the only place in the region where you can get stem cell transplants. So we have that program, and as well, what's unique to us is we actually provide the treatment for pediatric patients out of the Cancer Center here in Kingston. We work in partnership with the hospital to provide surgical cancer care for patients who come into KGH. We do a lot of that work. We have specialized programs in cancer surgery, things like head and neck cancer surgery and lung cancer surgery are examples of the only kinds of care that you can get here in Kingston. Partnerships are a fundamental part of how we work in cancer care, because while we do a lot of work out of the Cancer Center in Kingston, we're part of a team of organizations and providers that actually deliver cancer services in the region, and we work extensively with the Canadian Cancer Society and have been for a very long time, for many, many years. And they provide the volunteer program within the Cancer Center here at KGH. We work with them also to provide volunteer driver support for our patients who require transportation to and from the Cancer Center for their treatments. And we also, partnerships are essential with the other hospitals in the region, as well as the community support resources, community care resources that are available across southeastern Ontario. We get continuous feedback from our patients, and we get that in any number of ways on an annual basis. So every year we run a patient satisfaction survey, and we survey our patients that have come to us in that year. We get those results in January, and we work on the kinds of things that patients and families tell us that we're doing well as things that we can do differently. And we get continuous feedback from the patient feedback systems that are available through KGH that give us much more real-time information that's available to us to really improve how we deliver programs and services, and actually how we improve the patient's experience while they're with us. What we hear on an ongoing basis from patients and families who are referred to the Cancer Center and knowing that they're coming for their first visit is that it can be quite overwhelming, and that they receive an awful lot of information. When they're here for their first visit, they meet an awful lot of people who are part of a team of professionals and experts that they're going to meet when they come in for the first time. So they tell us that it's very overwhelming. The tips, and it's from the patients and families who have given us this sort of feedback, is to be prepared with questions. What we strive to do is partner with patients and families and make sure that they're seen as an integral part of the team, that come together around meeting their needs when they require treatment out of the Cancer Center in Kingston. So come with your questions, make sure that you get your questions asked. As well as we hear that often what works very well is when you bring someone with you, to be able to make sure that that person who's accompanying you on your visit is also prepared with questions, can take notes on your behalf, because my understanding is that there's so much information that comes at you during your first visit here, is that it's often hard to remember everything that you were told. And it's really important that when you're finished your visit in your home and you're reflecting on and understanding what's going to happen next and what the plan of care is, that you actually have available the information that you were told with your care team during your visit, but also take away packages of information that we're going to give you on your first visit.